Hi, my name is CJ Devgan, and welcome to Season 2 of Breaking Barriers. My goal for Season 2 is to discuss how digital transformation is redefining how care will be provided in the next 5, 10, and 20 years. I will be talking to leading minds in the healthcare sector and exploring how new disruptors are leveraging technologies such as artificial intelligence, population health, blockchain are reshaping the healthcare universe. Hello and welcome back to another intriguing episode of Breaking Barriers. Today my guest is Rishibhai. He is an associate director, Masters of Management in Artificial Intelligence at Smith School of Business, part of Queen University. Welcome to the show, Rishi. How are you doing this morning?
I'm doing great. Thanks so much for having me.
Fantastic. Would you want to add a little more to your intro for our listeners?
Sure. To give a little context about my background, as you mentioned, I'm running the Masters of Management in Artificial Intelligence program at the Smith School of Business. And prior to that, my background is really in entrepreneurship, innovation, and teaching and working in that space in the private sector as well as post-secondary.
Fantastic. Awesome. May I also request you to share a fun fact about yourself with our listeners?
Absolutely. For fun facts, I do love to travel and I'm a big fan of sports in general. So I have attended the 2010 World Cup in South Africa, the 2014 World Cup in Brazil, the 2016 Euro Cup in France, and I'm making plans for the next sporting events and trips combined.
Oh, fantastic. That's awesome. So you travel with friends, family, by yourself?
A mix. I did go by myself to the first time I ever went to the World Cup, but made many friends along the way. The next time we got a big group of people. And so we've been doing that as well. And whenever you can mix friends and family, travel and sports, I'm excited and you're likely to find me there if I can make it.
Definitely keep me on the mailing list. Maybe I can join you too.
I will. I forgot the Olympics in 2010 in Vancouver. I also did that. So Summer Olympics is one of the ones that I haven't done that I would love to do. So you never know.
Yeah, no, fantastic. That's awesome. So moving back to our main topic, as you know, objective of this show is to talk about latest trends that are driving the transformation in the healthcare sector. And before we delve into the role of AI in transforming healthcare and the way healthcare will be provided in 10 to 15 years, or say 2040, let's talk about, we all have our experiences with healthcare. If you would like to share with our audience your experiences with healthcare where you saw that this particular process must change.
Right. Okay, so yes, modernizing healthcare is a very interesting topic. I think growing up in Canada, we have a unique perspective within North America as having two different systems in Canada and the States. And I'm actually from Saskatchewan, where our healthcare system was founded by Tommy Douglas, who brought the idea of social healthcare to Canada. So I think that really our discussion in terms of modernizing in Canada revolves in part necessarily around the idea that we do believe in healthcare as a right for all Canadians. It's something that should be accessible. And since our neighbors to the south have a different two-tier system, there's always a conversation about that. So I think just really important to the context of modernizing is the core values that our system currently is founded in, and the idea of universal healthcare and access.
I agree with you, and I don't want to get into the politics of that. Like you, I have experienced Canadian healthcare for over 2 decades. I have also a privilege to work south of the border and work with some of the large health systems in US. And I somewhere feel that our systems, our providers are a bit behind on adopting a lot of technologies. And I don't know what is the reason behind that. And that is a topic for another week with another gentleman. With you, we will focus more on AI, and we will stay focused on AI. And so share with our audience some of the use cases. So current state, how that process is working today, and how these use cases have or will transform those healthcare processes in future?
I think you're absolutely right. There are some inherent challenges, and you mentioned you'll talk about that in the future, but just having the system that we have, innovation becomes very difficult in a non-private sector situation. So you talk about applying principles of design thinking or these types of things into healthcare. It's a little bit more challenging, I believe, under the structure that we have. That being said, we have seen some really interesting examples of what AI can do. We know that Humber River Hospital is the first completely digital hospital that exists here in Toronto and Ontario, where the area that we live in. And so they've done a lot of interesting things and automated things that wouldn't normally be automated. And of course, automation is a big part of AI. If we can take tasks that humans would normally do, but that take time, increase the speed and potentially efficiency to assist humans so that they can spend more time in the critical areas of healthcare with more efficiency. That's a good example of one of the types of things that's happening locally nearby us, and that's a great example of modernization happening right now. And that being said, there are cases you can look at everything from diagnostic in for example, a computer looking at thousands and thousands and thousands of images of what cancer might look like, and being able to help doctors diagnose more effectively in terms of finding cancer earlier, for example. That's just one of the ideas. There's many different use cases we can jump into, but it ranges from everything from, like I said, automating certain processes, helping in diagnosing, and even in security measures. AI in some cases is able to detect attacks. Because healthcare, we know that there have been breaches of security in Canada of patient information. And in some cases, AI, is kind of unexpectedly on the other end of trying to protect data and privacy, which is a big part of the conversation in healthcare. Another quick example would be chatbots that help you to diagnose diseases quickly by entering symptoms, where they can really help the doctor have a good idea by the time the information gets to them of what they might be dealing with a patient, saving time.
I completely agree with you. All the use cases that you have identified, security, chat boxes, supporting and augmenting physicians. In future, some people even talk about replacing physicians, which I don't see, at least even in next 20 years. Augmentation is where I seriously see AI coming into play more. Now, let's delve into a very specific case, if there is a use case where we can delve a little deeper than purely touching it at the surface. Do you want to share
Absolutely.
that, please?
Yeah, and I'd like to, you mentioned, replacing physicians, for example. I think there is a lot of fear in the public because of what they see in popular media around AI or machines making decisions for us. And I just want to kind of speak to that and say that that's really not the intent. These are meant to be tools that assist, and as you mentioned, augment our decision-making process, and not to replace what a physician would do, but to allow a physician to focus on where they can add more value because they have assistance and tools that help them with what their daily tasks would be. So I just wanted to make that point right up, that we're not at a place where machines are going to start making decisions for us. That it's really going to be about assisting and augmenting our ability to make human decisions.
Absolutely.
And to jump further into a use case, I would say that if you think about something like determining the outcomes of any type of illness that you predict. Let's say you took cancer, for example, which we've talked about. If you took the historical data of all of the people, while protecting their privacy, not using names, but just took the historical data of all of the types of people that have gotten a specific type of cancer, a machine could look at that and start to find some of the correlations so that we could predict and both diagnose cancer earlier, which, depending on the type of cancer, if you look at colon cancer, breast cancer, some of the ones, a lot of the cancers are very high rate of life expectancy after the diagnosis if you catch them early. So in these cases, this is a good example of where AI could really help determine what the predicting factors might be to help earlier diagnosis, for example, and really improve the outcomes. I know that I believe that if you go back historically a couple of decades ago, it might be that about, I believe, 25% of cancer diagnoses would survive. And now I believe that number has doubled since that, because of improvements in healthcare. And AI, I believe, can help us take that next leap into accurate and early diagnoses of cancer, looking at historical data so that we can move initially from what we would look at as a diagnostic perspective of explaining what's been happening in the moment, then going to predictive, where we are looking at what might happen next, and then going to prescriptive even at some point, where we could look at some of the factors that lead to cancer and other diseases, and really, at that, look at prevention. Ultimately, going upstream, I think, is the goal of all healthcare. Ultimately, not to be reactionary, but to become preventative.
So this is excellent, and I completely agree with you. So based on your academic background, sure that you have a lot of interaction with these researchers. Where do you see we are? Like, is there still some more development that needs to happen in machine learning aspect of it, building this algorithm, or the gap today to make this thing available is the lack of all this data that they need to train on, or do you see some other barriers for us to get this thing in market? So my question is, where do you see, or when do you see this thing actually coming into play?
That's a very interesting question, and I guess there's a couple facets to the answer. And I think the first is, you touched on the idea that the tools, the algorithms are in place, and for the most part, we're quite advanced. The technology in the last few years, let's say 3 years, has really allowed AI technology to become widely applicable. But it is actually the data that's available. And in some cases, it might be the actual availability of the data and the difficulty in collecting it that remains an issue. The tools don't work without proper and what we call clean data that they can use. But then also there's the human side of it, of regulation. And in healthcare, this is especially relevant, where there's a lot of concern around data privacy. And so finding a way to balance the need for privacy with the need for innovation, so that we can have access to historical data that can help us move forward. And so I think that's definitely one piece of it. The other part is actually, very interestingly, a lot of conversations I've had in industry, and we do have a lot of interest in our program. We have people from the healthcare industry that come into our program, or that are going back into it. And it's very interesting that it's the bureaucratic side of running an organization that has to change to allow innovation. And one of the reasons I say that is, this is the first time that we're creating professionals that have business acumen, but also the technical know-how in terms of how AI works. And they are most often, because these are new positions in the last couple of years within companies or in healthcare, that are in the middle of a management structure that actually, for the first time ever, have the most business intelligence. So if you can imagine, it's different for a senior, let's say someone in healthcare, a senior person, to be deferring to someone who has technical skills they don't have to help make decisions. And so that requires an organizational restructure in terms of the way decisions are made. And that's a big challenge if you think about healthcare in particular, which moves and operates differently than the private sector, which also faces the same challenge to reorganize. That's a big piece that is a challenge for innovation, is how do decisions get made, and how do we reorganize our org charts really to reflect where the business intelligence lies, which is now in the middle of the structure, where it never used to be. It used to be top down. Design thinking brought it to a bottom up type of information structure, and all of a sudden we have the majority of the intelligence in the middle.
I agree with you. Points that you're mentioning about bureaucracy, and especially in public funding healthcare system, bureaucracy becomes a real barrier to innovation. And the second point about collecting, a lot of data is being generated. And since 90s, when we have heavy duty digitization of our transactional systems, a lot of data has been generated, and a lot of organizations have collected and stored that data. The challenge is now to denormalize and take out that privacy part out, and then aggregate that data so that we can create some meaning out of it. And that is where both private and public sectors have been behind. And I personally have not been able to find an answer to that. We all talk about data as next gold, People talk about uranium, they do a lot of buzzwords, so people don't want to part ways from the data. So that's where the challenge is. And I think there's a whole sector coming up of data aggregators, which will be third party, and they will not be selling data, but they will only be sharing data. Do you have any more expertise that you can share with our audience on how this data aggregation and collection part can function in future?
Absolutely. I think you touched on something interesting. You mentioned private and public sector, and really a lot of this innovation around data and its use in healthcare is actually going to be a partnership between the private sector and the public sector. And so one of those challenges when you talk about bureaucracy, for example, is in the decision-making process. So to figure out who will allow what we do with the data, that will take time. But even a contract, if a private sector company is looking to engage in a contract with a public healthcare system, first you look at the zoning and the breakup of the health divisions, which are constantly in flux and have been changing. And so if somebody wanted to bring in, let's say like a scheduling software to help automate scheduling for a hospital or health region, that might take 6 months to a year just to be able to do that. And the same thing on the data side, where if you're looking to change regulations around what data can be released, then you're looking at a long, cumbersome, lengthy process most likely. So the data is available, but both the intersection between private and public sector takes time because things have to go to tender because of the nature of those business relationships. And then also the decisions on what to do with the data takes time. I think of a small example, which isn't directly related to AI, but if you think about just your health donor or your organ donor sticker on your health card, that is a choice that each person has to make of whether they want to give access to that part of their body once they pass, or you could look at it as the information in the same way. We have to make decisions individually, potentially in the future, about what happens with our medical data. And you touched on the idea of third parties. And I think we really are going to get into a discussion about having third-party brokers of our information. And we'll have to have a discussion about the monetization of data on the individual side. Corporates have already figured out a way to monetize individuals' data for corporate gain, but will individuals be able to monetize their information at all as well? So that's going to be an interesting part of this whole discussion.
Yeah, absolutely. So I don't know if you're aware of it or not, but in US, what they have tried to do is ensure that patients have access to their claims data. So anyone who has Medicare or Medicaid, all their claims data is aggregated and made available for our patients to download. I think if my memory serves me right, it's called Blue Button. And they have a version 2 out earlier this year. And that enables patient to extract that data. And if they desire, they can share that data with whichever provider they're seeing. So, or they can fill in a form and authorize that provider to access that data directly from the Medicare side. A lot of large insurance companies are also agreeing and creating similar APIs, standardized APIs for people to get access to that data. And that, I think, will be a great move in that direction, because as we touched upon on the AI thing, the most important input to a good AI is lot of data and quality data, so we can make intelligent decisions. So we are about 10 minutes from the bottom of our hour. Do you want to talk about another use case that AI is going to change something about patient experience or something like that?
Definitely. I did also just want to follow up on something, I was thinking that the next logical piece of the conversation is what you mentioned was around insurance. And that has huge implications. I think that's one of the reasons there is such a big conversation about data privacy, is because insurance, the more information that exists on an individual, the very different outcomes that may arise for insuring a person based on their medical history. So that is a huge piece of the discussion that we could definitely delve into. But I just want to touch on that. I think you really hit the nail on the head, and that insurance is one of the key parts of this discussion, and whether or not they gain access to people's medical records or not, and how that would affect people's ability to become insured. That's a huge piece of the conversation.
Absolutely. If you want to delve into that, we can definitely talk about that. Do you have an opinion? Yeah, you can share your opinions.
I think that it's very interesting. It's an interesting discussion to be had. I mentioned the monetization of not only what is my data valuable to me in some way if I disclose it, is it valuable to others, in which I think we all agree that yes, it is. Like whether I'm donating an organ, as I mentioned, or I'm donating data that can advance somebody's medical outcomes. But in the same way, can that data be used against me? Can an insurance company deny me or increase my premiums based on having access to that data? And currently, it's interesting if you look at away from healthcare to an example in private sector. Companies are able to access your data if you're searching for something on the internet, for example. They can buy that data from each other, so that if you were shopping for something, they can access the information from a competitor's site to try and sell you similar things. So that's quite interesting when you think about how is data acquired. And right now, it's not that highly regulated. And so in healthcare, when we talk about insurance, I think we just have to think about all the ways, especially if we know that policy will be slow. And in a lot of cases, companies have sort of an ideology of, let's just do this and suffer the consequences later. Let's not ask permission, but just ask forgiveness if it comes to that. And so in healthcare, this becomes extremely relevant in terms of how people could access your data that you may or may not be aware of, that could affect not only the health of other people in a positive way, but also could affect your own financial ability to receive healthcare yourself, even though we're in a social universal healthcare system in Canada.
Yes, it's a very valid point, and we will have that discussion in another episode, which has both pros and cons.
Absolutely.
Health insurance companies can help you improve your health if they know in advance which direction you're going, and at the same time, the private mindset of individual will say, okay, you're going to cost us a lot more money. If you want us to insure, we're going to charge you more money, or we won't period insure you. And that's where government has to come into play and create some kind of regulations where insurance companies cannot deny individuals insurance or can raise premiums. But we are seeing that in every other industry. In car insurance, if you have multiple accidents and you're a bad driver, your insurance premiums are higher than, say, for example, mine. Kids at 25 pay a lot more insurance than people at 50 at my age.
Right. When I think the most important part of this right now, because we're in the early days, maybe the Wild West of data, of figuring out how we're going to solve these problems. The reason podcasts like yours are so important is because you're helping debunk some of the myths that are out there about AI, in this case, how it works, what it does, and what it doesn't do. Like, for example, we talked about it doesn't replace decision-making for doctors, but also it helps raise the appropriate questions. So once you've debunked the myths, you actually get to discuss the relevant questions, and it can be a matter of politics or point of view, which side of that we end up on as a society and as a country. But it's important to be having those discussions early and having those discussions in an informed way, which is why I'm so glad you're doing what you're doing.
Thank you so much, Rishi. I appreciate that. And that's the whole idea, is to initiate discussion. One of the challenges what I have noticed, and I've been born and raised in India, but I've been living here for 25, 26 years now. Healthcare is a no start in any political campaigns. We cannot even talk about healthcare in any meaningful fashion. Only after elections, when politicians start to make decisions, we start to talk about it. But not at the time of campaigns. Like, we are going to get into a campaign mode in a few weeks. People are not going to talk about some real issues that are pressing our healthcare. Cost, for example, healthcare cost is something like, and again, I'm not entirely up to date on this thing, but I think it is 16 or 17% of our GDP, which is high, So it cannot remain the same. So status quo is not an option. It is too important to remain in status quo. We need to change it. We need to look at new technologies. We need to look at new regulations to improve it.
Oh, sorry. I was going to say you're so right. And I mentioned, Tommy Douglas earlier. That I'm from Saskatchewan, and that's where he's seen as the father of our modern healthcare system here. But a lot of people don't know the history that when that change was proposed to be made, a lot of doctors went on strike and were upset, and a lot of people unfortunately died as a result of that change. So change can be costly and difficult, and so that'd be very difficult at the time to say, is this worth it or not, to be losing lives in the moment in order to make this drastic change that not everyone was on board with. And I would say that most Canadians now, looking back, do appreciate the system that we have now. But it's I guess the cost of innovation in the time, hopefully it isn't lives. But that's why you're right that we can't have taboo topics of things we can't talk about. And you're right, in the political arena, it's difficult to discuss the change in innovation because people can be afraid of change. So I just think you brought up a good point that I want to touch on, of the history of change is not always pretty either. And that's why it's important to talk about it and understand the implications.
So we are 2 minutes to the bottom of our time. I want to thank you for your valuable time and sharing your experiences with our audience. Would you like to tell our listeners more about the program that you are running at Queen?
Absolutely. And thank you so much for the time. Really appreciate it. The program that we're running at the Smith School of Business, we're very excited about being able to merge business, which Queens and Smith are known for, and into AI. And so really this is the opportunity for the first time to be able to have both a business education as well as a technical understanding of AI. And so that could go into analytics, of course, but we're actually also delving deep into AI. So things like machine learning, reinforcement learning, natural language processing, and coding in languages like Python. And so these are skill sets that we are seeing employers demand. And that's why we were one of the first in the world to come to market with a program like this. We're right in downtown Toronto. You can actually work full time while you do the program. And we're just seeing our students go do amazing things. And it's very cool in education to be able to say that our students are going into industry or are in industry and doing things that have never been done before. And that ranges from healthcare. We do have a physician coming into this year's class. We have people working on human trafficking with the Toronto Police Force. We have people in private sector. We have people switching in and pivoting into new areas, including healthcare. So it's just very exciting to see what this skill set really means in terms of making meaningful decisions that are really going to change the future of how business is done, how healthcare is provided. And we're really excited about having a program like that.
Awesome. Again, appreciate your time and sharing your experiences with our listeners. I wish you a great day, a productive day, and I look forward to having you as a guest again in season 3.
Oh, thank you, CJ. Appreciate it. Maybe we'll see you at the World Cup or the Summer Olympics.
We'll definitely do that.
Sounds great.
Thank you. I appreciate it.
Thank you.
That is all for today. Thank you for listening. If you are a healthcare executive and grappling with challenges to transform your organization, contact me and let's talk. If you like our show, please subscribe, leave a rating and a review for us on iTunes. Ciao and have a productive week.